You've assessed the scene and perhaps you've applied your barriers. Now you're ready to begin primary assessment. Primary means first in a series or sequence. Assessment is an evaluation or an appraisal. Primary assessment helps you recognize life-threatening conditions and prepares you to provide priority emergency care. By conducting a primary assessment, you will be able to answer the questions: is the airway open? And is the patient breathing normally? This is the AB portion of the ABCABS memory word. After you conduct a primary assessment, you proceed immediately to attend to any life-threatening conditions you discover. No matter what the patient's situation when you arrive, you begin with a primary assessment. Primary assessments all follow the cycle of care sequence that speaks directly to a pathway of priorities for emergency care. Throughout an incident, you continually monitor the patient and use the cycle of care to guide you, ready to provide assistance based on what you learn from your assessment. Watch this emergency scenario, noting how the cycle of care guides the rescuer. After the scenario, we'll review how the rescuer applied each step.
Hello? Ricky? It's Evan. I'm an emergency responder. May I help you? Ricky? Ricky, are you okay? You okay? Yeah, my friend just collapsed. He's not breathing and he's unresponsive. 3234 Tomas Street. Yes. Thanks. One, two, three, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. One, two, three, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16,
The cycle
17,
of care
18, 19, 20,
answers
21,
all
22,
questions
23,
about
24,
what
25,
injuries
26,
or
27, 28,
illnesses to treat first. For instance, suppose a patient has serious bleeding and doesn't appear to be breathing normally and is unresponsive. What do you do first? Easy. The cycle of care guides you. First, you assess the scene. Make sure it's safe for you to approach the person in need. Then quickly, seek answers to the questions. Is the patient's airway open? Is he breathing normally? To do this, first open the patient's airway and then quickly check for normal breathing. This patient isn't responsive or breathing normally, so if you're alone, you need to call emergency medical services. Next, immediately begin chest compressions.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
After giving chest compressions, open the patient's airway and begin breathing for the patient. Chest compressions and rescue breaths, CPR, takes priority over serious bleeding. ABCABS and the cycle of care correctly leads you through the priorities of care. In this scenario, you deal with the fact that the patient is unresponsive and is not breathing normally before you treat his serious bleeding. If the patient begins to breathe normally and becomes responsive, then you can attend to his serious bleeding. Let's look at primary assessment, first with a responsive patient and then with an unresponsive patient. A responsive patient is one who is alert and able to answer questions. Begin with assessing the scene. Stop, think, then act. Next, give the responder statement. Hello, my name is, your name. I'm an emergency responder. May I help you? Because responsive patients are talking or making noises other than gasping, you've verified that their airway is open and they are breathing normally, the first two steps in the cycle of care. This patient is responsive and is breathing normally, allowing you to skip over the CAB portion of the cycle of care. There's no need for chest compressions, opening an airway, or breathing for the patient. Keep the patient still. Do not move the patient unless you or the patient's safety is compromised. Put on barriers if immediately at hand. However, don't delay emergency care if barriers are absent. Next, check for serious bleeding, shock, and spinal injury. As you move through the cycle of care, alert the emergency medical service if you find any serious medical condition. Now let's look at the primary assessment with an unresponsive patient. An unresponsive patient is one who is either completely unconscious or one who may be partially conscious but incapable of response. Begin again by assessing the scene. Stop, think, and then act. Make sure it is safe to help the patient. Next, give the responder statement. Hello, my name is, your name. I'm an emergency responder. May I help you? This patient doesn't respond to your statement, so tap him on the collarbone to further check responsiveness. While tapping the patient, ask, "Are you okay? Are you okay?" After delivering the responder statement, quickly check for an open airway and normal breathing. If you are unsure if the patient's airway is open or if he is breathing normally, quickly open the patient's airway using the head tilt chin lift. To perform a head tilt chin lift, first place your hand on his forehead. Next, place your fingertips under the point of his chin, like this. Finally, gently tilt his head back and lift his chin. Another method of opening an airway is the pistol grip, like this. When the patient's airway is open, check for normal breathing. To do this, look for chest movement and listen for breathing sounds. Also, with your ear next to his mouth, feel for expired air on your cheek. This check for normal breathing must be accomplished quickly. If the patient is not breathing normally, he needs CPR immediately. Avoid long delays. If the patient is not responsive or breathing normally, ask a bystander to call EMS and secure an AED if possible. If you are alone, use your mobile phone to call EMS. If you do not have a mobile phone, leave the patient to call EMS if no other option exists. This is the call-first approach to emergency care. You call first to activate emergency medical services, then you provide assistance. This unresponsive patient is breathing normally, so continue your primary assessment by checking for serious bleeding, shock, and spinal injury. If a spinal injury is suspected, keep the patient's head, neck, and spine immobilized and do not move the patient. If no spinal injury is found or suspected, and you may need to leave the patient, place him in the recovery position. The recovery position allows the patient to breathe easier since there is little pressure on the chest. It also decreases the risk of something blocking his airway and allows fluids to drain should he vomit. To put an unresponsive breathing patient in a recovery position, first position the patient's arms like this. Next, grab the patient's far leg just above the knee and pull it up, keeping the foot on the ground, like this. Now, gently pull the patient towards you, putting him on his side. Once on his side, place the patient's lower hand near or under the neck for stabilization. If need be, gently pull back on the patient's head to assure an open airway. If the patient has to be kept in the recovery position for more than 30 minutes, consider turning the patient to the opposite side to relieve pressure on the lower arm.